Hi, my name is Diya Mankotia, and today I'll be exploring the design and implementation process for a cost-effective eating disorder awareness model that I implemented at my high school this year. To introduce myself, I'm a rising senior attending McNeil High School in Austin, Texas. As a young mental health advocate, a majority of my work focuses on creating inclusive and accessible mental health resources for school communities. As a program coordinator for the National Association of Anorexia Nervosa and Associated Disorders, I co-developed their school ambassador program, which brought eating disorder support clubs to over 25 campuses across 17 states in the U.S. Additionally, as the co-founder of Project EDSA, a youth-led nonprofit focused on distributing free resources to underserved communities, we've built a team of over 50 volunteers nationally, all working to create change within their communities. First, let's begin by defining and establishing the urgent global crisis of eating disorders. Estimated to affect more than 30 million Americans in their lifetime, eating disorder pose an urgent risk to the population. In just the past decade, the global prevalence has more than doubled. This graph shows its relevance back in 2018, and now it's increased even more, jumping from 7.5% to roughly 9% of the US population. The consequences of eating disorders extend beyond just physical aspects. Instead, they can be viewed through the biopsychosocial lens, where they pose severe consequences to our physical, mental, and social health. With one death occurring every 52 minutes, these conditions have the second highest mortality rate, and there is an increasing need for comprehensive care. What's more is that more and more adolescents are being diagnosed with this illness. With the age of onset being during teenage years between 10 to 19, it is estimated that 1 in 5 youth will be diagnosed in their lifetime, out of which more than 80% will never receive the support or treatment they need. This treatment gap is driven by a complex interplay of perceptual, educational, and systematic barriers that prevent adolescents from receiving timely care. Public stigma stands as the primary barrier. Compared to other mental health conditions, eating disorders are often trivialized and perceived as self-inflicted. These attitudes are reinforced by cultural narratives that frame eating disorders as a lifestyle rather than medical concerns. As a result, affected individuals internalize these patterns, leading to increased self-stigma and decreased help-seeking rates. On top of that, low mental health literacy about this disorder worsens the impact of this stigma. Even though schools have been identified as key players in providing mental health education, only 10% of schools offer resources specific to eating disorders, leaving a substantial gap of around 75 students and staff feeling unequipped to support themselves or their students. A major barrier that prevents schools from implementing such programming and training is cost. While professional-led models have demonstrated efficacy in reducing stigma, such as the Body Project, these models are often resource-intensive and require a lot of funding that many schools, especially in under-resourced districts, simply can't afford. Moreover, the global cost of eating disorders totals to more than $64.7 billion annually. Early intervention can reduce long-term treatment costs by preventing the disorder from worsening and reaching the hospital and treatment facilities in the first place. However, recent research has found peer-led interventions to offer a promising alternative to costly programs. This leads to my research question. This study aims to address that gap by exploring how I could create a student-led awareness campaign to bridge these resource gaps while providing a cost-effective models for schools to adopt. My project uses an applied exploratory research design to develop, implement, and reflect on a student-led eating disorders campaign. Adopting the intervention mapping framework, a research-based framework used to design effective health promotion interventions, my methodology follows a four-phase model. First, there's a needs assessment. In this, I conducted an environmental scan as well as a literature review, which became the foundation for my intervention, highlighting gaps both on a national and local level. Phase 2 involved the developmental phase. Building on what I found in the needs assessment, I analyzed successful mental health programs, past school-based initiatives, and academic research to determine what the most effective and feasible strategies for raising awareness are. After that came implementation. I created the resources, developed the materials, worked through all the formal logistics, and reached out to the counselors and principals, promoting our initiative via social media, school announcements, and posters. The final step was evaluation, which was informal. I implemented this project during Eating Disorders Awareness Week from February 24th to March 2nd. Since the focus was creation, not testing, I used community feedback and observation rather than formal surveys. The design process led to a four-component research-backed eating disorders awareness campaign. Each product was grounded in research, addressed key gaps in awareness, stigma, and greatly increased access to support. The four products I ended up creating were a peer-led educational presentation, mental health activity booklets and resource kits, as well as a digital resource page. The next few slides goes more into detail about each of these resources. First, to improve access to digital resources, I created an online resource page on Google Docs. This included over 20 national organizations, treatment directories, and educational tools. After sending it to my counselor and principal, I received approval to have it posted publicly on my school's website for anyone to reach. Second, to reduce stigma, I created an educational presentation using Canva. The content was mapped around the most common knowledge gaps I found during my needs assessment, and all data was pulled directly from reputable sources such as the National Institute of Mental Health to ensure credibility. This content was then presented during 3 lunch and learn sessions, in which over 200 students and faculty members were reached. As a thank you for attending, I also created mental health resource kits and activity booklets. These kits were built around research showing that tangible tools improve engagement and emotional regulation. I collected all the materials through a school-wide donation drive, keeping the project cost-effective and community-driven. Each kit included a self-guided activity booklet, which I designed in Canva and printed using both my home and school printers. In total, I ended up creating over 150 mental health booklets and activity packets. So why is this important? Well, an estimated 13 million adolescents will be diagnosed with an eating disorder over their life. Schools, where students spend most of their day, are in a unique position to provide early identification and prevention. Yet, despite that, most schools still lack this program, largely due to cost barriers. This project shows that with the right tools, students can lead meaningful change in their campuses. Mental health awareness does not have to be expensive to be effective. It just needs to be intentional. And sometimes even small steps and a single student voice can be enough to spark change across an entire community. Here are my references. And I would just like to thank the National Association of Anorexia Nervosa and Associated Disorders for their continued support for me leading change. Additionally, I would like to thank McNeil High School and all the counselors, principals, and students I collaborated with to make this campaign possible. Thank you so much.